Welcome back to the audio guide from Pennsylvania Medical Marijuana Cards. Today, we are taking an honest look at glaucoma, a condition that actually holds a legendary place in medical cannabis history. Back in the early 1971, landmark observations published in JAMA proved that smoking marijuana could lower intraocular pressure by roughly 25%.
It really is a foundational condition, and that's exactly why it was written directly into Pennsylvania's Act 16 from day one. But as we explain at PennsylvaniaMarijuanaCards.com, the modern science surrounding glaucoma care is far more complex than standard cannabis websites ever care to admit. There are major clinical limitations that patients absolutely must understand to protect their sight.
Let's dive straight into those limitations, because the biggest hurdle that medical science never managed to solve with botanical cannabis is simply the duration of effect. How long does that pressure-lowering benefit actually last?
Only 3 to 4 hours. That is the core issue. Glaucoma is a progressive disease that requires continuous 24-hour eye pressure control. The optic nerve doesn't get a break while you sleep. To treat glaucoma purely with dispensary cannabis, a patient would have to consume substantial doses of THC 6 to 8 times a day, around the clock. The constant psychoactive impairment would leave you completely unable to drive or function normally.
Wow, that makes a primary treatment plan completely impractical. But your guide also highlights an even bigger shocker, something clinicians call the CBD Paradox. Most people assume CBD is entirely harmless, but what does the data say about using it for glaucoma?
This is a critical warning. Clinical trials and animal models show that CBD does not lower eye pressure. In fact, at higher doses, CBD can actively increase intraocular pressure, which can make glaucoma worse. Even worse, when you mix THC and CBD in a 1-to-1 ratio, the CBD can completely block the pressure-lowering benefit of the THC. If a patient is trying to manage eye pressure, CBD-dominant products are completely inappropriate and potentially dangerous.
That is a massive revelation that could save a patient's vision. Now, let's address the systemic blood pressure issue, because cannabis is known to lower blood pressure throughout the body. Why is that uniquely concerning for a glaucoma patient?
Because the health of your optic nerve depends entirely on blood flow or perfusion pressure. If cannabis lowers your systemic blood pressure too much while lowering your eye pressure, it can actually starve the optic nerve of vital oxygen and nutrients. This is exactly why the American Academy of Ophthalmology and the American Glaucoma Society explicitly state that dispensary cannabis cannot be recommended as a practical clinical treatment to alter the course of the disease.
Incredible. So with all those strict caveats from major medical bodies, why is glaucoma still legally listed as a qualifying condition in Pennsylvania? What are the scenarios where an MMJ card actually makes clinical sense for a patient?
It serves as a vital adjunctive and palliative resource. For patients with advanced or intractable glaucoma experiencing severe eye pain, cannabis offers profound relief. It's also incredibly beneficial for managing the deep anxiety or sleep disruption that comes with a vision loss diagnosis. In those cases, we aren't trying to change the disease trajectory. We are focused entirely on improving the patient's immediate quality of life.
That distinction brings perfect clarity to the patient's role. So if a resident or a loved one wants to safely and legally access the state program through our telehealth practice, what does that process involve?
We provide a completely transparent and structured medical pathway. Step 1 is filling out our quick 3-minute online form at PennsylvaniaMarijuanaCards.com. Step 2 is a secure, private telehealth consultation over video. You'll meet with a state-registered medical provider, like Dr. Jonathan Chance Miller. His official NPI number and state licensing credentials are fully transparent and published right on our website.
And your practice upholds that identical protective medical standard? If for any reason our medical team reviews their eye drops or medical history and determines cannabis isn't a safe or appropriate option, there's no risk.
Exactly. We operate on a strict medical-first philosophy. If our doctors find that cannabis poses an unacceptable risk to your optic nerve perfusion or that you don't meet the state's qualifying criteria, your $159 evaluation fee is fully and immediately refunded. If you are approved, Step 3 is automatic. We submit your state certification the very same day. We also remind patients to never replace their prescription eye drops and to always disclose their cannabis use to their primary ophthalmologist. Exceptional clinical honesty, complete safety transparency, and absolutely zero financial risk. An invaluable guide for the glaucoma community.
Absolutely. If you are ready to explore medically guided, risk-free symptom relief for glaucoma-related pain, anxiety, or sleep disruptions, go to PennsylvaniaMarijuanaCards.com. Complete the form at the top of our page and let our medical team assist you today.
Book your telehealth consultation today at PennsylvaniaMarijuanaCards.com. Thank you for listening and take care.